Welcome to Unhinged and On Call. I'm Dr. Chelsea, your resident veterinarian.
And I'm Trish, a registered vet tech who's seen it all. Each week, we're pulling back the curtain on the wild world of veterinary medicine, from late night emergencies to barnyard drama.
No filters, no fluff, just real stories, real laughs, and maybe a little emotional damage. Thanks for letting us share the madness with you. Welcome to Unhinged and On Call. Today you have Trish and I chatting about some stories that we've basically lived through. Seem to get to, we've gotten to the other side of them.
Yes.
So we wanted to share them with you because some of them are recent, and then there's just a compilation of funny ways that people pass out when you're treating their horses. Because a recent one came up, and I have a whole host of stories to share.
So funny. Oh my gosh. Well,
first, Trish has unlocked a new fear because, guys, like so I'm a millennial, right? Like I'm 84.
I'm 88.
Yeah. So then my girl, I don't know if you feel this way. My girl was a thing because growing up, I was absolutely sure that at some point, like I hadn't been stung until probably I was like 22, 23. But because I'd watched My Girl, and there's, for people that haven't seen it, there's a scene where
it's Macaulay Culkin.
It is Macaulay Culkin, right? Okay, like knocks down this huge hornet's nest essentially in a forest, and then gets stung a million times. And I don't even remember the outcome. Does he die?
I don't think he dies.
No, I don't think he dies. But it turns out that he's
That movie
allergic
is
to
sad.
bees, and then it started this whole fear because I probably watched the show when I was like, or movie 8 or 9 or 10.
Yeah.
I don't know. So that just during your formative years, I was always scared of bees, right? I have since gotten over that because I've been stung many a time and I'm not allergic.
You're not good.
I had this like kind of crazy.
Well, it's one of those things. It's like you don't know if you're allergic
like,
until
do I
it
need to
happens
carry an
to you.
EpiPen? I don't know.
I've only been stung twice. One time I was at a pool and I sat on a bee on a chair and it stung my ass. And then the other time was actually with your husband on a call. We were on a farm call, and I went to open the door handle on the truck, and there was a wasp inside of it, and I grabbed it and it stung me on my hand.
Oh my God.
So of course I cry. Yeah. I'm like, Brett, I just got
it
stung.
does hurt.
Yeah.
I mean, it's not fun.
No, it's not fun. But this definitely new fear unlocked with this story because I didn't even know these existed. It feels a bit like Hunger Games when I talk about this. So so I'm at the barn and I'm riding, and I usually do like a little, trail situation. I'm working on my horse being a little buddy sour. So we're being brave by ourselves somewhere else. And then I usually come back to the arena at the end. So I'm riding back to the arena, and there is a gal there that I did not know very well at the time. And she's standing there with a vet and a tech who I also didn't know. But they kind of yell at me from further away, and they're like, "Where are you going?" And I was like, "Oh, I'm just riding to the arena, and I was going to ride around in there." They were like, "Whatever you do not go to the round pen," which our round pen is even more down the property, like on the other side of the arena. And I said, "Oh, no, I won't. Don't worry." And they're like, "Okay, good." And I finish up. I come back over because she was clearly in the middle of a appointment with her veterinarian, right?
Okay.
So I didn't go over to them, but I'm talking with her. And as she walks up to me, I'm still on my horse. She walks up to me, and her whole face is swollen. Like, I am talking, it was crazy. It was so bad.
God.
And she looked at me and she was like, "We were warning you because there are ground bees in the round pen." And what they were doing, I came to realize, is that they were doing a dental on her horse, first of all. So they tried to go in the round pen because, for those that don't know, you sedate them obviously first, and they were going to do their appointment in the round pen.
They just needed a space.
Yes. So they got the horse sedated in there, but then literally a few minutes later, they step on, or the horse steps on a thing of freaking ground bees. Like, what the hell? First of all, I don't even know what a ground bee
was a thing.
Yes. The more people I talk to, the more I realize how many people do know about
Thank
them,
goodness
which
I don't
makes
know
me
it's a
feel,
thing.
I know.
That's fine.
And so she, the owner, got stung, I believe, 16 times because they will re-sting you. So they will keep
They don't die.
attacking you. They attacked the horse. They attacked the veterinarian, and they attacked the technician. So they were all stung well over 10 times with this. And then still, like, power to the vet, because they still came out and finished the dental. Yeah. Just outside, in a different area. But
your whole body being stung.
Yeah. So I feel like, when we're writing,
because I'd be like out. I'm out.
I know.
I'm
and
done
now
for the day.
I didn't know they existed. And now I'm like on the trail, like, is that a ground bee thing? Like,
so yeah, we look it up. They burrow in like soft sand or areas that they can make, but they make their like little nests in the ground, obviously, but in the soft sand. So you don't see them until they swarm and they come out and they get you.
Well, and I learned a story about my older sister when I was telling her this, when this happened. Erin, my older sister, she was at summer camp when she was younger. So I don't know, 30 years ago, but she's at summer camp. She stepped on a ground bee thing and they chased her through the woods all the way back to her camp.
Oh my God.
Yeah,
so
she said she got stung so many times.
Because I'm like one bee around one wasp, I'll like kind of walk out of the area.
Yeah.
I'm like,
I don't
not going to swat it away. I just want to get out.
Yeah.
But if they follow you, like that's a whole nother level.
They will attack you and follow you. So that's why I said Hunger Games, because it's like release the ground bees or like activate the ground bees. It's just crazy. I don't know. I don't know.
Well, now we're going to have to watch where we walk.
Paranoid.
Everywhere.
I know.
Everywhere.
I know. It's so crazy.
Oh
this episode is brought to you by our friends at VetCS, your go-to for veterinarian-developed CBD and wellness products for pets and horses. Founded by veterinary professionals, VetCS offers science-backed formulas made with premium hemp extracts to support calm behavior, joint health, and overall wellness, whether you're in the clinic or out at the barn. VetCS is all about helping animals live better naturally. Want to see what they're all about? Head over to vetcs.com to explore their full line of CBD products.
So crazy. So you have to tell me about people passing out because
okay. Well, this is a lot. So buckle up. This is a lot of stories.
Okay.
Okay. So last week, this is what brought it up. My husband, Dr. Brett, is an equine veterinarian, and we're in practice together. And so he had a castration with kind of a younger gal in her 20s, and her horse, and he likes to lay them in dorsal, which means they're on their back. All four legs are kind of up and like very balanced. And so his technician, Kate, will be, or whoever's helping him, will be at the chest and kind of checking vitals and, helping and handing things, but essentially is holding and stabilizing the horse. I like to do them in lateral. I don't know. Everybody has their thing.
Yeah.
But that still requires one person holding a leg. I just think it frees up your tech a little bit. Okay. But anyway, what is funny about this whole situation is that the owner of the horse really wants to get into it and see everything. And so she's like in there, and you have these huge emasculators. So they're, 18 inches long, big old steel things. You're stripping the membranes on the testicles to get it out. There's sounds, there's noises, stuff is slimy and bloody. Yeah. Like there's a lot going on.
Yeah.
And so she's talking, da, la, 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 and they're just working, but she's a chatterbox. And then all of a sudden she's not talking, and she is slumped over the belly of her horse. Like she was standing right next to it. Her horse broke her fall. So she lands like on its sternum, chest. And Brett says she just crumples like where essentially like her head is resting on her knees, but she's on her horse, like just leaning. So, luckily some people go backwards.
True.
Luckily her horse broke her fall. Sack of potatoes.
They're both out. Horse is out.
Both.
She's out.
Horse and owner are out.
No.
So then Brett is finishing the second testicle emasculating. They've got a timer. So at that point, you've got very little that you're doing. Where in the field, we do them half closed. And so that means that you don't actually suture the outside incision. And so he's pretty much done. So he takes his one sterile glove off, and he's going to try to like get her into a safe area, because when this thing wakes up, obviously she needs to be
she should not be there.
So usually when people pass out on us, we can kind of just like sit them up, help them like stabilize so that they can sit up, but then their body regains tone and wakes up a bit, right? Because now you're sitting, and your blood pressure kind of regulates, right?
Yes.
Well, she didn't. So Brett had to grab her by the elbows and like basically give her a big old bear hug and then drag her backwards.
Like a dead body.
Like a dead body, 20 feet or so backwards is what he said. And then she still wasn't awake, so she couldn't sit up. So he had to lay her flat out. Funniest part of the story that got me, because I'm not even there. No. They're in a sand arena. There's 2 drag marks from her feet and legs.
Oh my God. Did he take a picture?
Because he had to drag her.
Like, look what I did today. First of all, good thing he CrossFits. Like he's so strong to dead weight somebody in the sand. Like that's even harder.
She's literally a sack of potatoes. So then, of course, Brett's starting to get worried. He's like, why isn't she coming too?
Usually people wake up.
People come too.
I feel like you pass out and then like a second
very
later you're
quick.
Like what happened?
Like literally
what
2 seconds maybe. It have been all of mine that have happened to me. And so she doesn't wake up. So get this, our technician happens to be an EMT. So then Brett is like, Kate, switch me out. Go help her.
Oh,
because she's not coming too. Like anything. Yeah. So Kate knows you actually. So if anybody ever has this happen, she's like fully out and on her back, and you take their legs and you pump the legs, like basically have like their knees bend up towards their body. And that pumps the blood flow kind of back. Right. And then she like pretty immediately woke up.
Wow. Way to go, Kate.
But I think if like I didn't know, I wouldn't have known to do that.
No,
like a non-EMT, we just happen to have an EMT out.
Amazing.
Nobody else is on the property.
Oh my gosh. Yeah.
He would have had to call 911.
Yeah, he probably would have. If time passed even more. That's
so, and she comes to, and she was really, obviously they got her situated and all that. And the next day he checked in. He's like, how are both of you doing?
Both feeling?
But it's just so funny because people like you do want to watch, and then all of a sudden you just get kind of lightheaded. You got to sit down.
You almost don't realize what.
Yeah. Well, you
will
did
trigger it,
You did.
Oh, I almost passed out for sure, but
you knew you have to have a little bit of self-awareness.
Yes.
I think is what it. And so I think all these stories today that I'll tell you are people in their like 20s, teens and 20s.
Yeah.
Because one of them just a few months ago was a keratoma, and luckily that girl knew. But same thing, chatterbox got real quiet. We're removing a keratoma from her horse's hoof. So you kind of have to like cut open the hoof.
Yeah.
And she did pretty great until the end. And then she was like, I don't feel. And then she just cuts out.
Oh no.
And so we were able to catch her. That was Sam and I at VetWorks. We were able to catch her and like go get her some water and sit her down. And she's young. That was an easy one. Liz, my technician, who's like the best. Awesome person ever. She passed out on her interview.
She did. Oh, Liz.
So if you guys are looking to get into tech work or even vet work, you can pass out for sure as a vet. But she on the very first day we had a castration, and she luckily I don't know who was scrubbing because it was my castration. So I had a tech, and then she was the interview.
Okay.
I happened, and she's a little bit smaller than me. I happened to get behind her because she just started crumpling and she was going to fall flat out. And I did have sterile gloves on.
Okay.
And I reached out my elbows behind her and just let her like fall into me so I could essentially guide her back.
Was she quick? She woke up quick.
Yes.
After that.
So quick.
She's a fast one.
Yes. Oh. And so basically as soon as I like sat her down, she was like, what came to. But yes, that was another one that to this day, she's never had another issue. Like we hired her. She felt, I think she was pretty mortified because she's was new to it and all that. Right. But had seen, she'd had horses and seen blood and all that. But something about like the combined noises. And then if you have a pressure, like either your animal or like she was kind of probably feeling a little bit nervous being on an interview. Yeah. She was young at the time. She was 20. Right. So, but nothing since then.
Oh my God. We had a girl pass out. We had like a feline cadaver lab. In school. Yeah. And that does not smell good.
It smells
bad.
Formalin.
Yes. And I think it was like
the fat.
First for all of us,
the smell
actually.
Of the fat is like nobody warns you about that.
And they're like, remove the liver and cut it in half and all the things, right? So you're like really in there. And she was kind of sketched at first. Like she even probably questioned why am I in this school?
Okay.
Like just her face. She was not into it. And she all of a sudden, same thing, like sack potatoes, just dead weight fell on the floor.
But that's like concrete.
Yeah, it was hard. It was like the tile floors that we had in there. So by the time the professor like ran over to her and like turned her over, she was awake. Okay. So it was one of those fast ones. Like, what just happened?
You got another one down.
She was excused that day.
Another one bites the dust.
Yeah, exactly.
Another one bites the dust.
I was like, maybe if it still continues to happen, this might not be the field for you. But and I'm like, cool. Cut open this. I want to cut open the heart. Let's look inside.
But right. I always want to get in there more. I think Brett, his 4th year, developed like a little bit more of a queasier stomach than the rest of the years. Because you do in vet school, you do most of your anatomy first year. Yeah. And then you have pathology 2nd, 3rd year. You have all these classes. Mm-hmm. But we had a bone lab And he had to do Vicks in his nose
Yeah.
for the bone lab because you boil down like to make skeletal preps.
Oh,
you boil it down and it's like a pretty gnarly smell. You can't really get anybody prepped for.
Ugh.
And I just happen like my stomach doesn't really usually bother me like that, but he had to do Vicks the whole week because you have to like get this, like there's soft tissue preps and then there's bone preps and stuff like that. And it just smells extra. Like it's not right.
That's so much.
So I just remember, and when I think the first time he did it, he put like a glob of Vicks in his nose.
He's like, wait, I can't breathe.
And it freaking burns.
Oh,
no,
yeah. Oh, yeah.
So you just got to swipe it for anybody going into anatomy lab and you have a queasy stomach. You just got to put a little bit in.
Smart. Okay.
Yeah.
Oh my God.
That's the trick is a small amount.
Oh my gosh. That's awesome.
I do. Yes, I have one story I'm going to tell of another girl that did not come to, and it's not my story. So both these are kind of stolen.
Okay.
But I just remember it because it's hilarious. And I tried to get my mentor that this happened to on his watch. I tried to get him on the show and he's too shy. So and I'm going to speak for him and I'll let him know. But this is too funny of a story not to share. Okay. So he's suturing a laceration, which I've had 2 go down on me during laceration suture. Like just the blood. Whatever. And stress. And so this is a ride along. So she's, I think, an extern.
Okay.
Like pretty new student wise and all that.
Okay.
He is suturing this wound and he looks over and she crashes face down in the dirt next to him. So he has to take his gloves off and and put his instruments away for a second. But she falls like under the horse. I remember that.
Oh,
and she comes up and he's trying to grab her and she's a sack of potatoes.
Yeah.
And they're the only ones around, I think. I don't know if anybody else was there to help him because based on the story, you'll hear there probably wasn't.
Yeah.
He realizes that her mouth is full of fucking dirt.
Stop.
Like she
just ate. She literally ate it.
Shit.
No.
And it's like in a horse barn, so it is probably part shit, part sand.
Yeah.
So he feels bad. She's not coming to. So he starts, and all he can describe is that he can't get her head to stay back to rinse her mouth. But he doesn't want her to aspirate, so he's kind of holding her.
Sure.
So he like grabs her head and kind of her hair, and then gets
what?
Gets like an oral dosing, like either a big catheter syringe or something. But she has to be like facing down, otherwise she'd aspirate in her lungs. But this like a mouthful of dirt.
It's kind of like
and she's not coming to.
Like a equine lavage before you do a dental. Yeah. You like they're hanging down and you're kind of squirting it.
Dosing syringe.
A dosing syringe.
So I remember him saying he gets like the most of it out of her mouth that he can just with like a glove and finger.
Okay.
But then is like rinsing her mouth. And I think she finally came to she finally woke up when there was like water spraying in her mouth, essentially.
Crying and laughing so hard.
Like these things that you don't.
So she woke up while she was.
I think towards the end of it, but it was enough to like wake her up because you kind of like some of them you'd need like smelling salts, or apparently you need to pump their legs. Like
that might be.
But you like have a full on syncopal event, and some of them don't come too.
Oh my God!
But I just think it's so funny because you never. Just like one of our guests was saying, the last episode was, you never know what your day's gonna be, and what's gonna happen, and then somebody faints on you and eats shit, and you're just trying to help them out.
She's like flossing later. She's like, "Why do I have this pebble in my tooth? Why is this tiny rock in there?" Oh man, that sucks. Poor girl.
The PSA of today is
don't
just
eat dirt.
Well, if you feel lightheaded or fuzzy or not right, just sit down, get some water, say something.
Yes.
Like, don't try to be a hero and push through it, because then this shit happens.
Right.
You, fall face
I tried.
first.
We talked about it on one of the episodes about how I almost fainted because I was so excited to buy my horse.
Horse girl. Fan girl.
After I rode him, I got off and I looked at Chelsea and I was like, I think I need to sit down. And then I tried to tough it out later and come back to it, and I still couldn't. So you don't need to be the tough guy, right?
Don't be
sit down.
Just sit down. Take a break. Everything's okay. Everybody does it.
Yes.
I had one time, I'll say this because this is pre-vet. I don't think I don't even know if I've told Brett this story.
Oh.
It's not that good, but I will tell everybody now. So I used to volunteer in the dermatology service at CSU.
Oh, okay.
So pre-vet, you need to just get hours. I was mostly equine, so I had all these horse and large animal hours. I did not have a lot of small amount of hours, so I needed to volunteer.
Yeah.
What that was, it was Dr. Rosachek. He's amazing. Okay. Canadian and hockey guy and all that. And so, and then later when we went to vet school, like they played on the, it was a faculty and student, essentially hockey league or whatever. Cool. Great people. So the dermatology service is amazing. What I don't know. I think the night before we had kind of an all-out bender. I was drinking a lot, so I was really hungover the next day. And we just had the general gist of allergies is that you're looking at animals with like really gross skin and itching, atopy, all the things. And for the most part, you're, especially at a referral center, you're doing intradermal testing, immunotherapy for allergies. And rechecks, right? Yeah. So this is a new patient exam, has come in as a referral, has been refractory towards like probably at that time, because this is 20 years ago, like corticosteroids, and we didn't have all the Apoquels and the itch blockers. So, so we're doing intradermal testing, and all it is you get the trays ready, and that's kind of like what I would help with is you just have all these tuberculin syringes. They're tiny. Yeah. And all you have to do is shave the dogs. I'm pretty sure the dogs are sedated. Okay. Lightly. You shave a patch on their like side, and you just do these little bloods.
Down the row. Yeah.
And then you come back a little bit later and you mark how reactive they are to those certain allergens. Because I was so hungover, we were in this like I think we were reading, I don't even think it was the injection part because it felt dark. I all of a sudden was like, I'm going to lose it. And I got really hot, and I wasn't sure if I was going to puke or faint. That's but I did not feel good. Yeah. And I had to excuse myself, and I was like, I'll be right back. And I went to the next exam room, which is empty, and like fucking sat there with my head between my knees for a minute. Oh no. And I got all the feelings. Yeah. And then luckily it like passed. I got some water. No. And then I could finish the appointment later and stuff. Oh my God. But it like such a simple thing. Dude, it was just
you just never
intradermal testing. Yeah. Like injections are no big deal. Yeah. But you get the smells of small animal in a small room. And then it got hot, and then it was all the hangover. But
man. I told you I smacked my face on a table once.
No.
Passing out? Yeah, but not from vet med. Did I tell you the story? I was like, I was working at cafe. Before vet med, I waited tables for a long time, and I worked at a breakfast place. So this is also at like 6:30 in the morning. And I was younger. So I think I was maybe 20 years old. Okay. And TMI, everybody, just welcome to my life. But I just switched birth control, type of birth control. And I think that really is what this was. With you. Yeah. Yeah. And I looked at my friend, Katie, who I'm still very good friends with. And I looked at her and I said, I don't feel very well. I'm going to go to the bathroom. And as soon as I said that, I took a few steps and I fucking dead weight. I fell
because you were moving.
First. Yes.
You had momentum.
Yes. And there was one of the tables in the restaurant and I just smacked the table. And my whole nose was like, I was out, dude, out. She called the paramedics. Like they showed up. My whole face.
Did you break anything?
My nose was not broken, but I was black and blue and bleeding from my
no teeth.
She said it was the scariest thing that's ever happened to her because I was also like a really good friend of hers, and she was like, "Oh my God, it's Trish!" Yeah, she like they took me away in the ambulance.
How did you not knock your teeth out?
I don't know. I really don't. Wow. I've freaking dead weighted into the corner of the table. So it's like the worst thing ever.
Do you remember, were there a lot of people around?
There was nobody. It was me and her. Because it was like 6:30 in the morning. We weren't even open. We were about to like get ready for breakfast service that morning. So not only that, but then the restaurant opened and she had nobody. She had to call somebody. So all the people that came in at first, she was like trying to do it herself. I felt so bad. It's like a $10,000 paramedic ride, right? Yeah. Like in the ambulance. Because I told them, I was like, please don't turn on the lights. I think it's like extra.
I can't afford it.
Isn't
don't
it
turn on the lights.
I'm like 20.
I don't know.
Like I can't afford this paramedic ride. But yeah.
Oh my
so
God.
crazy.
And you didn't have to stay. They just checked you out.
Yeah. Oh yeah. I went home and everything after.
Oh my gosh.
It was the worst. I just remember waking up because of course you have no idea, but I woke up and I was just like pain. Like you just like, wow. You're like, oh, fucked up my face.
Wow. It's like you got punched in the face.
It was. It looked like that.
Worse,
Like when I was
probably.
healing and stuff, it was all like black and blue for so long.
That's so crazy.
Yeah. Yeah. I think my husband remembers that actually.
So yeah, I guess the updated PSA is as soon as you feel it, just sit your ass down. Don't try to walk to the bathroom.
No, don't go anywhere.
Just sit
down. Just sit down.
Your heart needs you to level out. So you got to sit and get your blood pressure up.
Yes.
Because that's what it is. People, it's dropping blood pressure.
Yeah.
And then you pass out. Your brain doesn't have enough to keep you vertical. God.
I hope you all find this information valuable.
And I would like this to be a spurring moment for any of you in the trucks listening to us during your days in practice. Please share and come on our show. It doesn't have to be super formal. It's not scary. We won't be
We're
mean.
super fun.
But please tell us your stories because we know you have good ones.
Yep.
So
that'd be awesome.
But
there's a little form.
Yeah, we have all the info next. We'll play it at the end. And you can sign up on our form, or just if you know us or whatever, email and just give us. You can even give us a synopsis and we'll read it out for you. But there's so many crazy stories that happen with fainting. So
I love it.
Do tell.
Yes, do tell.
Okay.
Oh my God.
All right. Thanks everyone for listening.
See ya.
Bye.
Thanks for listening, everybody. We would really love to have you as a guest on our podcast. So if you have any fun stories to share with us or would like to be a guest, we have a form on our website. So unhingedandOnCall.com. And you just click on the little link there and you can fill out a little bit about your story and yourself, and then we would get back to you. Or you can just email us to chat@unhingedandOnCall.com and just tell us a little bit about yourself. And we would love to have you as a guest.
We also are looking for ratings. So essentially on Apple, Spotify, wherever you get your podcasts, you can rate and review our show. And that would be super helpful in just getting kind of into the algorithm. And then additionally, we are on YouTube. So if you ever want to watch videos, we put more content, like visual content, so pictures, videos, things like that, into the episodes. So we'd love to have you follow or subscribe our channels on YouTube.
Yeah.
Thanks for listening.
Thank you.
Thanks for tuning in, and make sure you subscribe so you get all the latest updates. Unhinged and On Call isn't just a podcast. It's a lifeline for every veterinary professional barely holding it together with vet wrap and caffeine. Somewhere out there, another tech, vet or assistant, is deep in the same chaos, dodging poop, managing meltdowns, and wondering if they're the only one unraveling. You're not. Whether you're laughing, crying, or rage cleaning your truck, you've got a whole tribe behind you. You're unhinged, but never alone.